Hi, I'm Dr. Stan Michalski, the DDS coach, and this is the Coach's Corner. We're coming to you today from Hilton Head, South Carolina, where we should have a bright sunny day. We've got the Atlantic behind us. We've got a little bit of cloud cover, but we're not going to let that dampen our spirits as we bring you the third part in our series on case acceptance. Our first part, we talked about bringing energy to the operatory, lifting everybody up around us. In our second part, we talked about diagnosis and co-diagnosis, asking open-ended questions, helping the patient be involved in their treatment. Today we're going to talk about the first part of actually closing the deal. That's right, we have to sell the product. And remember, I said earlier that people will buy what they want, not what you tell them they need. So we have to determine and make sure the patient absolutely knows what we have just talked about. Dentists think they do a great job at this part, and this is actually where they do a terrible job. We ask two questions that are very closed-ended, but they're awful questions. The first question we ask a patient after we've gotten through explaining all the parameters of, let's say, a missing tooth in the lower left-hand side. We could talk about a bridge, we could talk about an implant, different types of implants, possibly even a partial in some cases. We ask the patient, which they're very proud, we've discussed everything, do you understand? What's the patient always say? Yes, because they don't want to feel stupid. They don't want to feel like they don't understand. And what that does, it ends the conversation. Do you understand? The patient says yes. That means you are done speaking. You have to get up and leave. The patient then can go back to the conversation they were having with the hygienist or with the auxiliary about their upcoming vacation or whatever the case may be. We go out and we talk to the scheduling coordinator at the end of the day. Hey, did so-and-so schedule for the bridge or the implant we talked about on number 19? They say no. Well, we get mad at the scheduling coordinator. The problem was the patient never really understood the treatment. So the other question we ask, which is a terrible question, is, do you have any questions? The patient says, no. Conversation's over again. Again, we go out at the end of the day and ask the scheduling coordinator, hey, did so-and-so schedule? No, they didn't. Well, we're mad at maybe the auxiliary didn't talk about it or the scheduling coordinator did something wrong. Absolutely not. The dentist did something wrong. Well, not something wrong, but not as right as it can be. Here's the first part of the process of closing the deal. We need to put ourselves as the provider below the patient, lean into the patient and ask them, just to make sure I've explained this well enough, tell me back in your own words what it is we need to do. Once the patient can absolutely tell you back in their own words what we've just discussed, you know for sure that they understand. You know for sure that they don't have any questions. And then we're ready to move on to the next step in actually closing the deal. This has been Stan Michalski, the DDS coach, encouraging you to get in the game.